This is a presentation on healthcare legislation by Robin Sis, Graduate School of Nursing at the University of Hartford. Course, Advanced Nursing Practice, Professor McLean, April 15th, 2021. Introduction. Mason et al. States from the book Policy and Politics in Nursing and Healthcare. As Americans continue to struggle with chronic disease and healthcare workforce shortages, access to healthcare providers is a challenge. As our population ages and chronic disease management gets more and more prevalent, there is a need to make a large shift towards primary care. Our healthcare workers are looking for ways to keep patients out of the acute care setting and managed in the community. Expansion of care is necessary to move forward. The triple aim model is moving our healthcare system in a direction where new concepts are being developed. According to Mason et al., the three major elements of the triple aim are to improve population health, improve the patient experience of care, and reduce healthcare costs. The implementation of technology in healthcare is steadily on the rise and has shown to increase access and quality of care while driving down costs. Although telehealth and telecommunications in healthcare have been around for decades, over the last year, it has been getting a lot of attention and utilization due to the COVID-19 pandemic. Today, I would like to present on a Massachusetts healthcare reform bill, S 2984, signed and approved by Governor Charlie Baker on January 1st, 2021. An act promoting a resilient healthcare system that puts patients first. Today's objectives will be to summarize the Massachusetts Health Bill, review its major concepts, define telehealth and its implications on public health, examine the advantages and disadvantages of telehealth, and analyze a COVID-19 telehealth study. My thesis statement for this presentation: although there are advantages and disadvantages to telehealth, telecommunication platforms continue to show positive outcomes across the healthcare continuum. For example, increased access to care, insurance coverage, decreased cost of care, and as Mason et al. Explains, telehealth is being employed by all areas of healthcare today. There are 6 major concepts to this bill. The overall premise of this bill is to expand telehealth coverage, access, and usage for the people living in the Commonwealth of Massachusetts. According to the General Court of the Commonwealth of Massachusetts, for the next 2 years, telehealth visits will provide coverage, also known as payment parity, to individuals the same as in-person visits. The bill will cover primary care and chronic disease management for 2 years. It will offer permanent payment parity and access to behavioral health. A major goal of this bill is to expand insurance coverage for telehealth. The General Court of the Commonwealth of Massachusetts explains that insurance companies may complete a utilization review and pre-authorization. However, the determination of these two things will be made in the same manner as if it was in person. Providers will not be required to document a barrier to an in-person visit, and telehealth visits should not be limited at a setting where they are being conducted. Telehealth provider reimbursement will be the same as in-person commissions for healthcare visits. A patient must be informed of their coverage and cost of the telehealth visit upon scheduling. If the provider does not work within a patient's insurance, then the patient must be notified at least 7 days prior to their visit. If this notification is not done, the provider will pay a fine up to $2,500. This was put forth to decrease any surprise billing from telehealth to the consumer. Telecommunication services should also obey state and federal health information privacy and security standards. Lastly, this bill requires specific data to be collected by certain agencies. This data will then be placed into a report, and this report will discuss the use of telehealth and its effects on access and cost savings in the state of Massachusetts. The report will be turned into the Joint Committee on Healthcare Financing and the House and Senate committees. This will be done at the end of the first and second year from when the bill was signed. Next, I'd like to review the definition of telehealth and its implication on public health. The Health Institute Center for Connected Health Policy defines telehealth as the following: a collection of means or methods for enhancing healthcare, public health, and health education delivery and support using telecommunication technologies. Other terms for telehealth are telemedicine, e-health, and mobile health. Throughout history, telecommunications has made a widespread impact on public health. The use of telecommunications in healthcare dates to the early 1900s, where Dutch doctors used telephone transmissions to monitor heart sounds and rhythms, and then later in the 1940s, NASA used closed-circuit televisions for telehealth. The further development of telehealth was used to reach rural communities that lacked healthcare support. Today, it is widely used for the management of non-urgent chronic illnesses, health promotion, and health education. In the last year, telehealth has made it possible for patients to visit with their providers and nurses while reducing the spread of COVID-19. In 2018, one study published by the Scandinavian Journal of Caring Sciences, 178 articles were examined pertaining to telehealth impacts on patients and their community. Research indicated that telehealth communication among the patient and nurse proves the increase of patient satisfaction and improved self-care management. The website mHealth Intelligence reported that the state of Massachusetts' new bill 2984 embraces telehealth to help promote preventative care and reduce readmissions. Next, I'd like to talk about the modalities of telehealth services. According to the article, Nurses Advancing Telehealth Services in an Era of Healthcare Reform, there are 3 different types of telehealth modalities. First, synchronous telemedicine means live, real-time, face-to-face audio and video calls using platforms such as Zoom. Asynchronous is not face-to-face, but utilizes communication between patient and provider through email, online patient portals, text messaging, and smartphone healthcare applications. It also enables exchanges between providers to communicate things like e-discharges and e-referrals. Remote telemonitoring involves home monitoring of chronic illnesses such as chronic monitoring, cardiac monitoring, and pulmonary monitoring. This is done at home using special technological devices where the patients can monitor their chronic illness and report it to their primary care physician. There are advantages and disadvantages to the Bill 2984. The Court of the Commonwealth of Massachusetts explains many benefits to telehealth consumers, such as increased access and care coverage for the next 2 years in the areas of primary care, chronic disease management, and permanently for behavioral health. This bill also allows advanced practitioners to see patients and charge accordingly. Patients will receive insurance coverage just as they would at an in-person visit, and providers will get reimbursed just as they would in an in-person visit. There are some noted disadvantages. Disadvantages of this bill is that it's only in effect for 2 years, providing that the report at the end of the first and second year prove that telehealth is beneficial to the public. General disadvantages to telehealth noted by consumers are poor human-computer interactions, privacy and confidentiality issues, and making sure that all parties involved understand how to use the technology platforms, and some reported technical difficulties. One case study examined 19 articles from CINAHL and 10 articles from PubMed. The articles were reviewed to determine the facilitators and barriers of telehealth during the COVID-19 pandemic. A variety of healthcare settings were interviewed on what they deemed as advantages and disadvantages to telehealth during the global health crisis. For an example, one large academic medical center said that a facilitator to telehealth minimized PPE usage and was able to save PPE for critical ill patients in their large hospital institution. Respiratory patients were not as a large concern in the virtual visits as in person. Devices also enabled isolated patients to communicate with their families. A barrier to telehealth that was identified in this case study, if we look at some agencies in Australia, the UK, and the USA government, they stated that the telehealth needed to become more integrated with health and social care service networks. And they still reported that telehealth just wasn't 100% suitable, was not a 100% suitable replacement for in-person visits. In conclusion, telecommunications in healthcare has been around since the early 1900s and continues to advance with numerous possibilities. Telehealth has its advantages and has its disadvantages. Although it might work for some patients, it certainly does work for a lot of them, especially our younger generation that is extremely technical savvy and enjoy using technology. The article Nurses Advancing Telehealth Services in an Era of Healthcare Reform states, telehealth can increase access to primary care and specialty care and ensure high quality care at a lower cost. I have one personal story with telehealth that I had to use twice over the summer. One was for my son, what looked like he may have had Lyme disease. It was a bullseye type insect bite. We did not want to rush him to the emergency department, nor did we want to bring him to his doctor's office in the height of the pandemic. With a virtual visit and uploading a photo, I was able to avoid the emergency department and pick up prescribed medication for him. I would like to end in a quote from Governor Baker. I've thought for a long time that because as a country we underinvest in primary care and behavioral health services, a lot of people who could be treated in the community end up in the hospital, and we basically have a chance here to study this question. I think we'll discover that by investing more or giving people more options to access care and supports, they will stay healthier and spend less time in the hospital. Thank you. And here is my reference page.